Hello, fellow STEMmy arsonists, and welcome back to another interview. This is Elannore.
My name's Elaine.
And I'm Abby.
And today we have Dr. Lynette Khoo Summers, a professor from physical therapy at Washington University School of Medicine in St. Louis. Dr. Khoo Summers, thank you so much for your time and welcome.
Today's interview covers Dr. Lynette's journey in STEM and physical therapy, and we're so glad that she is here today to answer some of our burning questions about the subject.
So, Dr. Lynette, could you start by giving our audience a brief introduction on who you are and what you do, or anything else you'd like to add?
So, I'm an associate professor at the program in physical therapy at Washington University in St. Louis. I do both teaching future physical therapists, also see patients in our faculty practice clinic. So I have actually the best of both worlds. My background, actually, I was a dancer before I became a physical therapist. And of course I got injured, and then I needed to do something else. And through the whole process, I said, physical therapy sounds interesting. And then that's how I pursued it after that. And that's how I'm here.
It's pretty impressive. It's pretty inspiring too.
Yeah. Before we delve into the specifics of your passion, we would like to know your motivations first. So did you experience any hardships in college because of your gender?
Unlike you guys who are mostly musicians, probably, or no? Yeah.
Yeah.
Kind of, right? So as a dancer, good or bad, it's more females than males, just because. So it wasn't hardship because of my sex and gender, rather than it's harder because there's more female dancers to get roles versus males, there's few of them, and they tend to get more leading roles just because there's fewer choices to choose from. Not that they're bad dancers or anything, it's just the way the dance world would be. So that's basically my dance world. Then when I switched to physical therapy, this is another good thing for females. Its majority is female roles. I would say 70% are females and 30% are males. So it hasn't been hard in that one sense of being somebody who's female rather than most other occupations and professions. It is definitely more male oriented.
Very interesting. So what inspired you to go into the STEM field, more specifically physical therapy, and what experiences solidified your goal of becoming a physical therapist? Because I know you said you got injured, but what is that eureka moment that you had?
So I tore ligaments in my knee and had to have surgery. And of course I needed physical therapy to rehab myself back, ideally to dance. And through it all, I had some problems that now I am more knowledgeable. My knee would not bend past a 90-degree angle just because of scar tissue. So the therapist worked with me for a long time, and finally the surgeon said, okay, well, we're going to arthroscopically remove the scar tissue and then you should be able to bend your knee again. While watching my physical therapist work with me, and this was back when I was in Chicago, the ballet company called Joffrey Ballet Company actually moved from New York City to Chicago at that point. So then that clinic where I was having physical therapy started seeing some dancers. And I was like, oh, I didn't know physical therapists could see dancers. So I just rehabbed it. And then I said, maybe I shouldn't be doing this. So because my degree was in the liberal arts, I had to go back and take more science classes. And that's how I kind of start thinking about what I wanted to do. The other opportunity I got before I actually made that decision was I was able to work as a physical therapy aide in the clinic where I had PT. just to experience what it is like to become a physical therapist, the day in the life of a physical therapist. And so I got to see what people were doing, and that sort of said, oh, this is actually interesting. I don't mind doing this. There were 2 physical therapists at that time at that clinic who actually graduated from Washington University. And so they basically nudged me along in that direction, which was definitely helpful because they gave us encouragement and everything. So I had to get my prerequisites done and basically said, this sounds good. I'm willing to do this because my physical therapist helped me. So I can actually, like what most people would say, I get to help people.
From your bio, you said you studied at CSU, and you just said you went for liberal arts, but then you had to transition to physical therapy. Why did you choose to go to CSU, and what were the transitions like? What are the difficulties of transitioning from liberal arts to physical therapy?
So I'm actually from Singapore, and my parents didn't want me to do dance because you can't make money being a dancer. So I sort of kind of tricked my parents into thinking I was going to do public relations as a degree. And I sort of kind of alluded to the fact that there's a small dance program, so they wouldn't let me go to a conservatory. Yeah, because I can't dance. So CSU, Colorado State, has a small dance program. So as soon as I got to school, I signed up as a double major. So I did public relations and dance at the same time. And so I did dance my way through school and had fun and danced. And then I did eventually get into a small dance company in Chicago. But through this whole process, I injured my knees and had to have, surgery and rehab. So that's how I ended up at CSU, changing from liberal arts to a science dominant career. My high school in Singapore, I did do physics, chemistry, and math as part of my high school. So I did have sciences already as part of my schooling, education. But then I had to go back and those didn't count anymore. So I did have to take some more science classes. Some of them I did enjoy. So I didn't mind chemistry or biology as much as physics. Math was okay. But the other course that I had to take before as a prerequisite is statistics. Didn't like that one as much. But the one I did enjoy as part of my dance major at CSU is anatomy. And so I really enjoyed studying the body anyways. And I think partly because I am a dancer, I need to know how my body moves. So anatomy was actually very cool. We didn't do human cadavers. We actually did greyhound dogs, but the teacher was very good at saying, okay, the dogs have similar muscles. They're just, attached differently, but here's what humans are. So I got to learn both. And it was just, for me, it was just like, how nice to know these are the muscles that made me move this way. So I really liked anatomy. And so I think that helped me at some point figure out, I think I would enjoy becoming a physical therapist.
Yeah, that's very inspiring knowing that you can experiment while you're in college and follow your passions. So I think a lot of high school students can learn from that.
But you have time, you're still young.
Yeah.
You can always pursue your love, which is music first. The difference, I think, between dance and musicians, if you have a career in music, because I see enough, musicians, you have a longer career because you can even perform and play your instrument, mostly strings, till like you're 80 versus, you know, woodwinds and brass. Most of the time you retire a little sooner, maybe in your 60s or something. But dance, the career is very short. If you survive by the time you get to 40, that's amazing career. Most people, you know, they end their career because of mostly injuries or inability to get a job. Most people retire when they're in their 30s, early 30s. So you have to look for something else to do, especially in the dance world versus musicians. You tend to have a longer career if you choose to have one.
Yeah, so diversify your portfolio.
Sounds good.
All right, Abby, would you like to take over a present career?
Oh yeah, I'm just going to ask a few questions about your current position.
Okay.
So, when did you assume your current position as a physician?
So, I started teaching and seeing patients at WiS.E in 2006. Prior to that, I worked in the Barnes Jewish Hospital System as a physical therapist, and then the whole rehabilitation program got bought by a company called Health South, which doesn't really exist anymore. Then we became the Rehab Institute of St. Louis. While I was a clinician, I made time to teach because I love to teach as well. So part of my time, it was less hours in the beginning. And then by the time I came into WiS.E, that's when I could pursue more teaching as well. So 70% of my time is patient care, and then 30% is currently teaching. And so
Good balance.
I get to do the best of both worlds.
What are some things that you currently struggle with in your career then, or that you hope to conquer?
So when you guys have your own career, it's always very hard to not do work at home. My husband's like, you're doing work yet again? I'm like, well, because a lot of times teaching, yes, you teach at school, but then a lot of times we have things like papers to grade that is not part of teaching time, or I have to prepare before a class, whether it's actual lecture or because like in the spring semester, I am a course master of an actual course. So I actually have to prepare now so that I line up my lecturers and part of the curriculum. So I have to do it now. And that's not part of my time at work. So it is very hard not to do work. So that's the education part. And then as a practitioner, clinician part, in the world of any medical field, documentation is very important, because otherwise, if something were to happen to your patient, not that there, lawsuits occur in physical therapy, like very rare, but you also want to make sure you document every detail. That way somebody cannot question what you've done. So documentation does take a lot of time, and a lot of time that's spent after seeing a patient. So I'm always catching up on trying to do my documentation after seeing a patient, and that sometimes is being at home and doing it at home.
Well, and then one last question. What has been a life-changing experience that has affected your STEM career, or like what achievements are you most proud of? Any published research?
So I can't remember how many actual research articles I have, probably 3 or 4. I also assisted in the rest of our faculty. We have textbooks, 2 of them that we help write for teaching. The specific theory that we teach at WiS.E is called movement system impairment theory. That is only primarily taught at WiS.E. And then our graduates who go into teaching, they also teach this part of that theory. So that was exciting. I do presentations sometimes internationally. So there was
wow, congratulations.
Dance medicine conference in Singapore. So I actually got to do what we call poster presentation, actually 2 of those. I've been to like Montreal and other, North American cities to do presentations of different kinds. So that would be my achievements, but I think mostly my achievements are, my goal in life is to get all my patients, if not just my performing artists, but all my patients back to an activity or something that they love to do. Because sometimes when you see a medical professional who especially don't understand musicians, dancers, whatever you do, they say, oh, you should stop what you're doing. And that's what you love to do, and they're not going to stop. So I will find ways to give you the knowledge that you need to make a decision. And if you want to really go back, and if there's nothing that is going to hinder you other than time and rehab, I will try and work my best with you to get you back to what you want to do. So, which is, I think, an accomplishment. Yes, you can never fix everybody. So people have had to retire from their performing arts career before, but it's also nice to know that I'm educating, future people to understand what they're doing. So like for you guys, hopefully you don't have to have an injury and see a physical therapist, but another way is to inspire somebody which I've had more dancers than musicians. They were my patients as a kid, and they saw me as a physical therapist treating dancers, but other patients. As they go through their college career, maybe they did get injured themselves, or they said, I don't want to do dance anymore. They said, oh, I had my physical therapist. She treated me and it looked very interesting to be a physical therapist. So I've had probably at least 5, if not more, ex-dancer patients go into the career of physical therapy once they decided whatever they couldn't dance anymore, did not want to dance anymore, they pursued that career. And I think there's so far been 3 patients of mine who've come through the WiS.E program at this point. So that's kind of nice to see them as students learning to become physical therapists when I saw them when they were younger as a dancer. So that's kind of nice.
It's great to see that you're able to not only treat people, but inspire people to pick a career path.
A lot of dancers, because the careers are so short, there's an organization called International Association for Dance, Medicine, and Science, but there's also one for performing arts called Performing Arts Medical Association. You will meet people who were dancers and they become surgeons treating dancers, or they become psychologists because they were a dancer. And mindset and mental health is also very important. So then they look forward to actually helping a dancer or a musician go through whatever that they're going through, especially like COVID right now. How do I have a career because I'm not performing? So there are definitely other professions in the medical field that you can actually pursue as a performing artist. So you get to meet all these people and look and talk about their previous careers, how like what you're doing with me, interviewing and talking about what led you to this point. Do you enjoy what you do, kind of thing? And most people I've met, they actually really enjoy what they do now. but dance or music has helped them also become a better person, as well as whatever career that you've chosen at that point. So being a performing artist is actually making all of you guys too, because you have to be very disciplined, right? You've got school, you've got to practice, you've got orchestra, you've got jury, and you've got all these things that you still have to organize your life. But you are also, I'm going to guess, straight A students at school. And so you are very good at what you do. And so that makes you be able to choose whatever career you want to be in, whether it's music or not. There's a whole world out there, because you can put yourself in a situation and say, I'm determined to do what I want to do, and try and achieve that goal, and try and find people who can help you towards whatever career you want to choose when you grow up.
Yay, awesome. So we just wanted to ask you a few questions about the more technical side of physical therapy.
Okay.
So what would you say is the coolest or most interesting thing you learned while working in this physical therapy?
I tend to come up with, my colleagues would say, all the weirdest exercises that I give my patients, because, so if, let's say, if you know what an airless is, like people swing on silks, like Cirque du Soleil, they do different things, right? So if they get injured, I need to get them back to that specific activity, not just combing my hair, but they have to get up in the air and hold something and be able to be spun in the air. Well, I have to come up with exercises to train those muscles to work the way they have to work and be strong enough. Or as a musician, just playing, let's say if you're playing a string instrument and your bow arm hurts, just doing bowing doesn't help you, because I need to strengthen those muscles. So I have fun using stretchy bands. They're called TheraBands. They have different resistance. So I'm tying one band over here, one band over there, and then you have to pull so that you're using your muscles to work. I think it's fun, because I think part of that is my creative background, and they come together because I think about, okay, how do I get whatever that goal is? I'm always coming up with crazy but cool but interesting exercises that my patients can do.
I actually like that a lot, because in tennis, before we hit, every day we always use TheraBands too for like 5 minutes to stretch out our arms and like make sure we're not going to pull anything. Yeah.
Right. Yes. So warming up is definitely very important.
Yes, for sure.
Do you have any favorite exercises that you've come up with over the years?
One that I think is kind of cool. So if you're a gymnast or a circus artist, you have to do handstands. So you can't just do handstands, because their shoulder is painful or very weak. An actual handstand will not be doable. So what I've done with that example is I make my patients climb onto, let's say, at home, their bed, but in the clinic, it's like a massage table. They'll get themselves with their legs on the bed, but their body on the floor with their hands in that handstand position. And then they can try and slowly put more weight on it. And then I can make sure they're using the right muscles to work on, and then slowly build up that way. So that would be somebody who does handstands. Musicians, my musicians hate this exercise, but it's actually really good. You have to lie down on your stomach, and you have to pick up your arms to work these muscles called your trapezius muscles that are by your shoulder blade, because generally most people, but this is very important too, that have weak muscles called your trapezius. So I make them hold your arm position, because when you're playing a musical instrument, you have to hold your arm a long time, right? So I make them hold up to a minute, because longer than that, it gets really very boring. But then I make my musicians pick a song in their head that they know is about a minute in length. So now they're singing the song in their head while they're doing an exercise. Maybe it won't be so boring and accomplish a goal at the same time. So those are a couple exercises that I think it's kind of interesting.
That's really cool. I know, at least when I think about physical therapy, I don't think of like exercises like that. More the standard stretching. But
now you know.
So you've mentioned quite a few times that you work with both performing artists and musicians. Do you think there's a huge difference between working with them as compared to like athletes who do sports?
So I think of musicians in the performing arts world. Musicians are called small muscle athletes, because especially your hands, all these muscles are really tiny and you have to use them all the time. Yes, your shoulder muscles and all those have to work, but musicians are definitely considered small muscle athletes. Mentality wise, the same stressors as an athlete, like a basketball player would, when it comes to, stress about trying to be as best as you can be. And so there's definitely similarities in that one sense. To me, the hardest part as a performing artist, whether it's a dancer, musician, I don't think you get as good of a care than your typical football, basketball player, because they make money. And most of the time, performing artists don't make as much money. The same thing happens, just, so you guys know, when you go to college and you decide to pursue, a music career, it's always hard when people go to college and talk to me and say, yeah, the athletic training department, only the basketball players and football players came to them as services, whereas because I'm a dancer or a musician, they won't let me go, which is very annoying and makes me really angry that they separate performing artists who they don't think do anything versus, these regular athletes. Too many times, here's an example. So I see non-performing artists too. And then when I talk to them and say, so, I treat performing artists like musicians. And then they turn around and look at me and go, yeah. Like, yeah, I do. Which might scare you, but 80% of musicians have some sort of an injury in the span of a year. It's scary. People do get hurt, but sometimes the basic community population, they don't understand why musicians can't get hurt, and they're like, oh, well, yeah, they just all long and they have to play a musical instrument in one position. And so that's also part of that education, I think, rest of the world instead of the performing arts world.
That's nice to know. So I know that you briefly mentioned the fact that WiS.E is sort of pioneering the theory of like the movement system. What exactly is the movement system, and how do you apply it to your teaching?
Okay. So the movement system in pyramid theory has gone through several names, and it was started by Shirley Sauerman. So in the PT world, if you mention just Shirley, everybody knows who Shirley is. She came up with the system of watching people move and what's normal motion, and then what's once you understand what normal motion looks like, and when somebody shows up and it does not look normal, we go through teaching our students what normal is, and then we can see what's not normal. And Shirley started it all. She, of course, right now you can't travel because of COVID. She travels all over the world teaching her system. So once a year, well, maybe twice a year, we get people actually from other countries to come into WiS.E to take a course specifically taught by us about the system. So we get people from Sweden and Japan to come to St. Louis and take this course. So they're physical therapists already, but they're interested in what we do. And then teaching-wise at WiS.E, we incorporate that about the way to think. So it is basically your basic anatomy, and then the other thing that you'll learn is kinesiology, so how these muscles move your body. So if you know your basic anatomy and kinesiology, that's basically what this movement system impairment is. And then we teach you how to correct it, so that if I can correct that impairment, then you should have less pain. So I'm always not only teaching somebody to stretch, but you also have to balance it out by strengthening. So this movement system, your front of the body should be equally balanced between the back of your body, or the sides of your body on both sides should be the same. So musicians, more so than dancers, you're always holding your instrument one way. There's no holding it the other way, right? So all your muscles get tight one way, and then maybe it's too flexible another way. So trying to help people balance it out, whether it's a performing artist or somebody who plays tennis. Well, you don't serve with your left hand if you're right-handed, and that's always what you do. So it becomes a problem when you do it over and over and over again. So my job is to teach our students to watch for those motions that are good and bad, and then that whole process of trying to figure out how to stretch or strengthen a muscle to get you to your optimal level to be able to return to whatever activity you want to do.
That's really interesting. It's cool to just think about how many people from all over the world come to St. Louis just to learn about that.
Yeah, it is very cool. The 2 textbooks that we have published have been actually translated to at least Italian, because there's a group of Italian physiotherapists who have been interested in this movement system for probably at least 15 years now. So they actually translated it into Italian. Then we've had a couple of our graduates who they live in the US, but they're actually from Japan. They've also translated the 2 textbooks into Japanese. So slowly but surely, they've been translating to other languages so other people can actually read it for their, to learn about what we do. So it is cool.
That's awesome. So our last question for you today, what is some advice you'd give to a STEM student or a young girl considering going into STEM?
So I think I alluded to all you guys already, that because you are very disciplined in what you want to accomplish, I don't think you would have a problem pursuing whatever goal. So whether it's STEM or music first, then STEM, you have a good background, like with your school. I'm taking 8 classes to last you a lifetime. So do science. How can I apply it? So there are some dancers or musicians when they decide not to pursue that career. There are also people who do research. So one of the current dance professors at WiS.E, she graduated from WiS.E's dance program, went to have a career in dance. She came back into our PhD program as a PhD student in movement science. And so she now does research related to primarily Parkinson's. So the cool thing is, it started probably maybe 10 years ago, if not more. One of the ballroom dancers who came into our PhD program started teaching ballroom dance to Parkinson's patients. And if you don't know enough about Parkinson's, when people who have Parkinson's, they actually, when they're walking, at some point they freeze. Their brain does not fire the appropriate way for them to walk anymore, and they'll just stop. Well, if you put something to music and dance, they keep moving. So it's really cool to watch them, and they don't freeze anymore. So the other PhD who now teaches dance at WiS.E, she came up with not dance, but actually music, like singing. So one of her research study is if you can sing to a certain beat, you're going to walk at that certain beat. So therefore, chances of you freezing, because you're concentrating on singing that song, it makes it not freeze. So her song is singing row, row, row your boat. And so if you sing at whatever tempo you want, the person with Parkinson's will walk at that tempo, and then they don't freeze. So it's really cool. And even go into research world. You name it, any STEM program, whether it's, becoming an engineer or a doctor is a typical one that you would choose. I think you guys have the foundation to work hard, and you know that some careers are more male dominant for sure, but in this day and age it is getting better and better. Even in the music world, right? Most of auditions for orchestras, at the last round you're hidden behind a curtain or a cover, so you take off your shoes, you go out, they only listen to what you're playing, not whether you're male or female. So they're trying really hard to incorporate women into any field at this point, but in a STEM program, I think you guys are all very smart young women, and you work hard, you're pursuing what you love. So I think you should not have a problem if you ever decide that you want to pursue something that's related to science and technology.
Yeah, as like a musician and a prospective science major, that's something really interesting, and I kind of want to go into it and just delve into more facts about physical therapy and anything of that sort.
So, I mean, you can even think about it as, okay, I am a musician right now, but I don't want to become a professional musician. What can I do? So you could do, an example is, okay, my goal in life is to help pianists. So if I'm going to do research in piano playing, hands are very important, right? Any musician. So what are the problems that pianists have? So then I'm going to study it and say, okay, small hands are harder to play octaves. We all know that. But why is that a problem? So there's somebody who studies that because they were a pianist before, and that's what they're looking into at this point. So you have the mindset to be curious too, and say, I had a problem with this. How do I go about accomplishing whatever that goal, that curiosity you have? Use it and say, where can I apply it? Whatever it is that you're curious about now or later, that's part of achieving.
Right. So thank you so much for sitting down and talking with us today.
Yes, thank you for
My
answering all our
pleasure.
questions.
Not a problem. I'd be happy to answer any other questions if you want to send them my way. I'm always telling people, if you have questions, whatever it is, I can help direct people to something that you're interested in, or not that you're going to get injured. If you need somebody to see you for whatever reason, starting with the doctor or something like that, I would be happy to help.
Yeah, so if anyone wants to check out her page, we will be putting her bio in the description. So please check it out.
Yeah.
Sounds good.